Good morning. On behalf of the Inter-American Conference on Social Security and the Study Center, the Inter-American Study Center, we welcome you all to this very important activity, which we have coordinated jointly as a joint adventure with actuaries and financing entities. Due to the assemblies, the decisions were made at some point to constitute this commissioner of financing and actuaries. Right now, they're represented by Panama, who has the leading role, and there's presence of Ecuador, Guatemala, and Mexico. And we also have, the technical secretariat from Guatemala is present. They're going to be participating with us during this morning session in this opportunity to share best knowledge. Social Security, we must acknowledge that from the get-go has faced very important challenges, which are economic sustainability, that's one, and two, that solidarity as part of coverage. Amidst the pandemic that we're suffering right now, there's a lack of equilibrium or balance in the strategies that countries or economies were promoting. Each country depended on its model of social security, which had to contribute for it to be sustainable. Now, there's different models that have been established to provide the attention in pension schemes and social security loans, but amidst the current reality, present reality, we're in a situation where there's a decline in labor job opportunities, and that's directly linked with sustainability because what's produced is a decline in the income, and that will impact all of us and each topic because of everything that's happening in all our countries. We are paying close attention to what's happening amidst crisis, and the pandemic has also taken its toll on social security because correlated to the health problem in social security, the system with most solidarity has made us build strategies to try to provide coverage to high risk people in our population. Besides these themes, we're going to be analyzing pension schemes, which are also being impacted by the financing issues, and also social benefits or social security benefits has been exercised in a very different way than the way we've been working usually. There's these three fields to discuss, and in that sense, we're going to see there's areas that are extremely sensitive, like HR, human resources, has been affected in all its areas. I mean, from if we have to think about social security and what's happened from one day to the next, we have to think about installed capacity, and I mean human capital, installed capacity, the management of different commodities. There's mismanagement in different areas, and we've communicated with different economies, trying to obtain the basic PPE or personal protection equipment has been very difficult to come around. We've had difficulties, and it's been extremely complex to obtain breathing or ventilators for hospitals in our wards. In all our countries, we have to think about our hospital networks and infrastructure. We've been providing services and seen that there's countries that have like certain strengths in the first level of attention with very strong campaigns that focus on prevention, trying to lead people to be healthy in an unhealthy environment. So that has led us to rethink at many times how to adapt the hospital networks, adapting and reorganizing our resources and human capital at hospital wards. The theme is not easy. And the other problem that we've seen is another topic, which is human capital. We faced losses. It's a sensitive issue. The workforce has been exposed because they're the first line, the providers, and there's fatalities in the first line workers. And we're also being impacted. There's repercussions in mental health and balance after such a period of stress where our human capital has been directly exposed. I mean, the family members of these people or relatives have also been affected in their bubble. There's different behaviors being triggered. And in some countries, Some of our first line workers or service providers are seen as heroes when treating people amidst the pandemic. There's other countries that have faced certain repercussions because when these nurses or healthcare workers go back to their household, they're seen as people that could be infected, and they've been also impacted by this. There's many factors that impact. We're going to analyze what's happening in Panama. Panama will speak about the variables that they've seen from since COVID-19 started. Thank you, Panama, for participating. Equator will also be discussing what's happening with their healthcare services. Guatemala will speak of the impact they've seen in their pension schemes, and Mexico will also touch on another theme that are the challenges in social security of the state or the public officials now and their services. Well, once again, we welcome you all. I want all the participants that are part of this webinar feel part of it and start asking your questions. We're going to have a session for a Q&A, and there's also going to be that open hotline so we can receive all your comments and all your contributions from the different economies, different countries. As the coordinator of today's activity, Gabriela Fernandez is present with us. She's part of our table. She has a degree, she's an actuary thanks to the Autonomous University of Mexico in Zacatlan. She also has a master's in demographics from Colegio de Mexico. She worked in ISTA Pensions, and she was responsible of the area of operation risk. She's been a professor of different credits in UNAM, Zacatlan, and in La Salle in Mexico City. She's also been an author of different journals or publications. The most recent publication, Strategies and Rights for the Youth and Access to Mid-Levels of Education. Gabriela is part also of the crew of researchers that we have appointed as part of our Inter-American Commissions on Social Security. She works with us in the area of research and as our professor in actuary or mathematics in our area here. Thank you very much. In general, well, thank you very much. Good afternoon. Thank you for being present. Thank you to all you keynote speakers, the organizers, and those who are participating. Today's intention is to share our insights regarding the COVID-19 experience. We can analyze the experience as an opportunity to rethink Social Security issues. When we speak about the assessment, the appraisal, and trying to prevent and manage economic resources in the systems on Social Security, we must also consider that they're part of the responsibility of actuaries and people who are experts in finances. This is why it's our core interest, or it's an interest of the Center of Inter-American Studies that's on Social Security, and of also the Inter-American Actuary Association here to analyze the aforementioned. The sanitary crisis that we're facing today allows us to visualize certain topics that are not under coverage in Social Security. During this webinar, we will analyze what we've observed till the present, to identify themes that require immediate attention and possible roadmaps and roads of action once the situation comes to an end as well. We invite you as our audience to draft your questions in the webinar platform, in the blog, in the chat. And later on, you can also send your emails to laura.vidal@cs or CISS wellbeing or bienestar.com, and we will also satisfy your doubts. And we have the presence of four elements of the Commissions of Actuaries and Finance. It's an honor for us to have you four here. Thank you for being. From Panama, we have Giselle Yvette Vargas Espinosa, who also achieved her degree from the Panama National University. She's a teacher and the fund administrator in Alcalá and Social Security professor from the University of Buenos Aires. From Panama, she'll speak about social securities and activities that have been affected by COVID-19. Giselle has been in her field over 20 years working on Social Security. She has been appointed as a budget analyst, a financial analyst, planner for management, and administrator in different executing agencies. Now, in 2011, she became part of other areas in actuaries, and she became part of the crew now she leads as a chairwoman. During her professional development, she's worked in different academic fields to always be updating her knowledge in areas which are correlated to finances and actuary. She has broad experience in actuary management administration in the private field, and she has had also the opportunity to be a professor in master's with the National Panamanian University. Giselle, welcome to the center, and the floor is open for you. I was asked to participate as part of the event where we're going to take into consideration our COVID experience, which is an opportunity to rethink the themes or top themes on Social Security. How is the pandemic of COVID-19 affecting Social Security in Panama, and specifically when? The question is, when is sanitary security is gonna, how are the economic consequences we're gonna see them, and also how does it impact financing? To rethink the question, we've decided to go through an assessment. The first points or the fundamentals in Social Security, we went through those fundamentals or principles, which are part of the Panamanian health service system. And we're also going to talk about the characteristics of the Panamanian society, the resources that the healthcare system in Panama has. We're going to have to go through an assessment of incidents that we've seen in the first few months with regards to COVID-19 and the disease. We're going to discuss the measures and the actions in place that the government has led, which are the results obtained to date, to present, and the thorough analysis regarding financing on Social Security as well, and the situations that must be considered amidst the pandemic, and our insights. Lastly, now Social Security is based on principles. It's a pillar, it's a column of social justice. It has the objective to end and have a decline on the lack of fairness and lack of equality. So people can also be contributors according to their means. They contribute with their means and receive benefits according to their needs. So this is a mechanism to redistribute wealth. Why? Because some say that having cuts on Social Security is, I mean, the financial flow or the capital flow is used, and there's an economic circuit to this. And in that circuit, this has a multiplying effect that we can even make tangible in our societies. It's based on principles principles which are compulsory. Solidarity is a principle, and it's universal. It's mandatory because being a mandatory member allows people to have access to the benefits, irrespective of the risk. I mean, there's benefits which are standard or homogeneous, and independently from the risks that the person has, they can have access to the benefits. There's solidarity as a principle because it reduces the lack of equality and fairness. It doesn't discriminate between those who are sick or healthy. It's universal as a principle because the coverage should be incremental. The broader the coverage on Social Security and our people, the better for our societies. Now, health. As a human right, it's a fundamental human right which guarantees the proper conditions for those who are in vulnerable conditions, have the capacity to achieve the top well-being physically, mentally, and socially. It is so important. This is important for our societies to keep a healthy population, the labor force in a healthy condition, because they contribute, and that's one of the core principles. Even if these principles are in our constitutions, in our charters. In the Panamanian society, the healthcare principle is a fundamental right. The Panamanian healthcare system is incorporated or constituted by different government agencies, bodies. The Ministry of Health is one, plus the Social Security Savings Unit is the main two bodies or agencies in this sector, because the health ministry is the guiding institute that dictates policy in health, while the social security uh, agency is the execution branch or executing body that has resources, human resources. We have our venue, and it has national coverage as well, which is extremely important. Now, by year 2019, we can tell you that the Social Security unit, that other agency, provides also services to 70% of the population, and the Ministry of Health needs to provide coverage to the rest of the population. However, we have to coordinate efforts. It's where one person can have access to the healthcare services from the Ministry of Health, a person that is insured by their benefits and it's a member, and there's a trade of benefits. The total population of the Panamanian Republic is of 4.2 million inhabitants, and they're distributed in a surface of 75,517 square kilometers, which gives the average of population density of 66 in our population per square kilometer. Now, these are distributed in 10 areas, which we call provinces. And we have 10 areas destined for indigenous populations. There's regions with higher population density that you can observe right now. If we analyze Panama City, the population density is 522.4 in population per square kilometer. In the province of Panama, in the west area of Panama, you can see the region of Araihan with 692.8 population per square kilometer. In the sector of the interior of our country, the city of Chitre, there's 642.1 in population per square kilometer. And a very important case that we have is a district called San Miguelito, which has 7,305.3 inhabitants per square kilometer. Now, the death rate in Panama is a 5.09 per thousand in population. The life expectancy when birth, there's a 78.51 years. That's the lifespan. The population is distributed from 0 to 14 in that age field is like from 0 to 14%, and then we have 15 to 59 is 61.8% in population, and those in our population who are over 60 are only 12.1%. In Panama, the death rate, as it's from 5.09 per thousand in population, you have that there. We have assessed that our population suffers different chronic diseases, conditions. We've observed then the majority of death causes here or conditions are tumors, malignant tumors, systemic heart disease, also diabetes, heart disease or stroke, and other conditions, and hypertension, amongst others. Now, regarding the installed capacity or the capacity that our healthcare system has, we can see now that there's beds and also some minors, or we had 9,004 beds and 7,100 and some physicians, doctors, odontologists were 600 and some nurses, 656 nurses. I mean, per capita, per 10,000 in our population is 7 physicians per 10,000 and nurses 7.9. So this leads us to a deficit of human capital or installed capacity. However, it is very important to be capable of verifying what we can observe now. The majority of our resources are located in urban development zones. Out of those beds and cradles for infants, we only had 338 intensive care units, and 6,080 were found in our hospitals. Now, our facilities in the Republic, give us a total of 863 in total. However, we had to verify that there were only 61 hospitals, and the rest were healthcare centers, polyclinics, sub-centers, or just areas. The resources allocated to both of these institutions by 2020, the approved budget was 3,844.3 billion, that are 16.5% of the general budget of the state, or gross domestic product, and 9.5% of the GDP was estimated by 2020. And the expenditure per capita is 900 in national currency per person. Now, the economic effects, we've been capable of analyzing the economic effects due to COVID-19. The economic areas were affected, which was transit, air transit, the flow of loads in the Panama Canal. Also, construction was affected, mines, and also quarries, activities, commercial activities, and wholesale and retail activities in restaurants, leisure areas and venues, touristic areas, restaurants, and SMEs, or small and medium-sized enterprises, which were affected. The financial institutions were also affected. Different institutions or companies changed their schedule because there was a passed law, because there were also some people who lost their jobs due to the pandemic and its effect. So the unregulated subjects of the Republic, people who are not contributing, are 716,000 people who are working subjects, which are not regulated, and due to the effects of the mobility restrictions, they were affected. Now, we're also expecting more activity in the agro field or agricultural field to include or to increase the production of foods. The impacts on the sanitary field, I mean, there's an increase in the quantification of cases of people, and there's an increment also in the cost of the products that we need to treat the disease. We need to enable new areas to treat our people. We need to hire more people who are part of the healthcare system and our professionals. We need to procure different equipment and commodities in global or other economies. All of these conditions or impacts in health have made the expenditure on social security and in the whole system in healthcare have that burden. The social impacts or effects are the following. We've seen that there's, due to confinement, the following cases have increased. Domestic violence have increased, criminal activity has increased. There's a lack of conformity and rebels amongst our population because of confinement, and there's citizens who do not want to comply with the preset instructions of sanitary precautions, which are the measures that we have adopted. Our government has issued its priorities. It has nationally coordinated effectively the social security agencies and the works of the health ministry to have readily available the intensive care units and wards and other sanitation units and products to treat the patients. We expedite the proper services and try to import all the equipment that is required, or PPE, materials, cleansing and hygiene products for our facilities. Now, there's an incremental investment in our installed capacity to adapt different hospital wards. We have even leased or rented hotels and adapted them to become hospitals. We have built another hospital with different modules that gives us 10 extra beds or ICU beds, and we're also having different opportunities to feed the poor and have some sort of economic benefit because of the unemployment of different workers that have been fired from different companies. We have had decrees that enable the labor force to continue, but we have that commitment because our people, once they lose their job, and once we go through the opening or adjustments at a corporate level, we'll see what's going to happen with the approved budget as well to pay the proper services amidst the pandemic. We reduce certain expenditures in travel expenditures in other areas and to pay attention to our pandemic. There's other travel expenses that have been reduced, and we have focused on the pandemic and the purchase or procurement of PPE, which also leads us to use the National Reserve for this purposes. It's something that was discussed and lobbied as an initiative which was approved by government or the legislator. We have also had to go through a debt. The national government has taken on that debt, and we're opening our economy per blocks, facing the risks that each economic activity poses or has. By the month of July, the national government drafted its new measures to finance the agricultural activities, SMEs activities, or small and medium-sized enterprises, with a trend or trying to give the economy and its openness, its dynamism back in blocks. We haven't been capable of opening block by block because of the increment in numbers of the propagation of the disease. And so we have another proposition and a project to open in the next few weeks. We want also another project. We have another initiative to cut the salaries of public officials. We can see that block one of like this opening of our economy in electronic services, workshops, mechanics, service, technical services, which are part of block one, trying to reach that new normal where, I mean, we started with those activities in the 13th of May. The type of block two activities were kicked off or started on June 1st. And then the rest of the blocks you see on the screen are pending to open. As I've explained, we suffered our setbacks. We suffered our setbacks because of the quantity of cases of people that have been sick. The numbers are incremental. What are the results? The ministry, the labor ministry and labor development has communicated that they're going to wait. They're waiting because there's a suspension of work or labor contracts or collective contracts, which are over 300,000, and there's reactivations of 28,000 job positions. The income till June, added 2,231.1 million, which lead us to think about the execution or the use of our budget, which is 61.7%. The execution of our budget or the use of our budget in June goes around, it's 76.2%, which gives us a deficit of 721 million in June. The economic activity during the month of April of 2020 declined a 34.7% in contrast to the numbers we had in April 2019. The infrastructure or construction activities, restaurant sectors or economic sectors, manufacturing units, and other activities, economic activities were affected. But we had a positive surprise. In each economic sector or in the economic sectors that we saw an incremental rate was in mining, transportation systems, mining, the movement of cargo, loads, or containers in our docks and ports at a national system, and also telecommunications, as well as the agricultural economic sector, which gave us a positive behavior. However, international entities as CEPAL have indicated that the GDP for the Panamanian economy, that our GDP will contract a 6%, and that we will have an augmentation of the levels of poverty in my country. These are the results. Sanitary results, which are during July 21st, we had this number of confirmed cases, 53,000, over 53,000, 1,159 deceased, 30,075 people who have been recovered. So the confirmed cases were 55,153, and daily recorded cases have been incremental. And these are the deceased. The deaths in our population have always increased, and we see the conditions and the propagation, and you see the 20 to 59 years of age and more lethality in those over 60, and those who suffer diabetes, hypertension, or obesity are also at stake. To go through the assessment of the situation, In the appraisal, we start assessing based on what's normal, what's common, and what's positive, and we see the consequences. We're trying to generate job opportunities that lead us to comply. I mean, the
Workers have their contribution for Social Security mandatorily, and this is translated into enough resources for the health services, which has happened in the case of pandemic. In the case of the pandemic, we have had a priority, and national government has made it a priority for health for the population. Still, we haven't had a good, development in employment and production, and the contribution of Social Security have gone down. It is also important to say that the facilities of the Ministry of Health are financed with contributions and taxations from workers, and it all depends on employment and the development of work employment in the country. We have to then to take the savings of the national funds and maybe external financing in order to get these objectives, so that creates solidarity measures from all the population, and not only that is involved in Social Security, which has been a measurement of solidarity for, from all the population. So we have to consider post-pandemic situations that we have to take into consideration with Social Security. We have to strengthen it, and we have to enhance the good things of these services, because it is good for us to have this tool, and that it has allowed us to give services to the population in situation like this. But we have to take a look at the financing mechanisms. We have to optimize expenses and diminish costs and produce savings to have enough reserve for the contingency for situations like this. We have to consider all the time the probability that there might be catastrophic events, or even things that are similar to these ones that we are suffering from now in the future. We have to widen the coverage of the health systems so that the whole population may have access to this. We have to redesign the schemes to give a preference to the preventive health care systems and curative healthcare systems in order for them to become preventive healthcare systems. We have to prioritize the scientific research and educate population to have a better response by the society if we face a future similar pandemic. And we have to define a state policy so that it will prevail in time, and try to diminish the gaps and the chances of development on the inequities that there are, in order to give service and warranty the service of health to the most vulnerable areas and less developed areas. Our final reflection then is that the pandemic has made evident the weaknesses of this health system, has contributed to make clearer the inequities in the society, which are based on the indexes of infection. The time of confinement had low levels of infections, but we weakened the economy because Panama has an open economic structure that is concerned or focused on the service factor, and has been weakened because countries close their borders, and there is no commercial exchange which normally occurs in these harsh times. To Panama has been a great value having a social security structure which is not perfect and has to be enhanced, but it gives an answer to most of the population even after 9 years of their creation. And we have the same conditions as in countries in the continent, but we have some differential points. And of course, the dosage of these differences depends on the particular situations, but it is also important to evaluate the measurements used in other places and share experiences so we will implement similar conditions in this pandemic. But it is for sure that in a COVID-19 regards, the solutions post-pandemic, we're still a long way to go. Thank you very much. Thank you, Giselle, for your participation. We we're going to contextualize before and after the pandemic to see the possible causes and the impacts by going through this experience and the measures adopted by the Panamanian government and the windows of opportunity. Our second speaker will be David Alexander Rales Nosquera, who's got a master's degree in business management by the Polytechnical University and a master's degree in tributation and commercial engineering specialized in finance by the Pontificia University of Ecuador, with experience as a teacher and public servant within the government of Ecuador. He's now the National Director of Business Management, being responsible for the institutional management processes and giving optimal times of response and an efficient use of institutional resources. David Rales is now the Vice President of the Commission. David, thank you. Welcome. And before you give your presentation, I will ask the rest of the speakers, when somebody else is using the floor, please deactivate your video and audio so that we will pay attention to our speaker. Thank you very much. So, David, welcome. Please, the floor is yours. Well, thank you very much, all of you, for the invitation to this panel. I don't know if you can see my presentation already. If you please confirm that you can see my presentation. Yes, we can see it. Okay. Well, before starting my presentation, I wish to contextualize a little bit what the dynamic we have in Ecuador regarding social security. And in this point, it is important to tell you that the Ecuadorian institution of social security is an autonomous administratively and financingly, which not depends on the government, but depends on a directive board by three parts, which is made by a representative of the affiliates, a representative for the executive function, and also the workers. And this is something pretty important because differently from other countries, we have independent institutions for certain benefits. In the case of IES, we have all the benefits incorporated in the same system, and they all depend on the same institution. We also have the coverages, the benefits of pensions, which cover pensions of elderly, of death, or help by the fund of health. And this covers subsidies of illness or maternity, and also gives medical attention either with our units. In the case of IES, we have 101 medical units, or through third parties, which are agreements that we have signed with different clinics, which in this case are private clinics. Moreover, we have the fund of benefits for work risks, which have pensions due to disability, and Montepio benefit and medical attention when indeed the illness or disease has been generated by, or is related directly with the work labor performed by the worker. Then we also have the fund of peasant social security, which is found differently from other countries, does not exist. We have a special fund that covers the agricultures and fishermen in the rural places of the country. And in this insurance are also covered some benefits that are pensions, funeral services, and also health coverage through what we know 652 medical dispensaries nationwide. And when the coverage is not enough, we can also have some agreements with external people. We have also incorporated lack of employment insurance, which covers people that have lost their jobs before the start of the pandemic. A person should have had been without work 60 days in a row so that they will be able to use this insurance. Nevertheless, there was a law which was passed a month ago by our assembly, and they determined that while the declaration of emergency due to the pandemic, the coverage, any person that may have had lost their job in a period of 10 days may use this benefit. This benefit covers the person by a period of 5 months, and be given $280 on a monthly basis to every one of the affiliates that has lost their jobs. This is just to give you a general scope of what the social security system is in Ecuador. Now, talking a little bit about the topic more about what has happened with the pandemic in the case of our country, it is paramount to understand from two great impacts we have had. One is coming from the part of income, which is directly linked to job or employment. According to different reports from international organizations, the Monetary Fund, CEPAL, World Bank, the impact of the pandemic possibly in the Ecuador is between 10 and 14% of the GDP. And this makes that since we have a direct relationship between the decrease of GDP and the number and the increase in the lack of employment, it may have a very important impact in what has to do with social security. In order to give you data related to January in comparison to June 2020, then we have lost 799 affiliates. And these people are distributed in the different sectors that we work with, such as public and private sector. Being the private sector, the one that has been impacted the most during this period of time, where we've seen a decrease of 11.86%, that corresponds to 238,717 people that have lost their jobs. So this process of the affiliation indeed has had a direct impact regarding the income we would think for this year. And additionally, it is important to tell you that differently from that, from the side of pension holders, we have an increase in relation to what we had in January. The increase of pension holders had been 8,003, and we calculate that by the end of the year it may hit even 30,000 pension holders. Some data that are also important to consider is that relation. We have found a coefficient of direct correlation between the GDP lost and the lack of employment and the de-affiliation. And we calculate that by the end of December this year, we will have 432,000 de-affiliated people during this year. Those are the projections that we have for this year. It is also important to tell you that from the place of the institutional budget, the IES budget is $805,000 million, which is about 8% of the GDP. The impact that we would be having, globally speaking, in all this budget, given the volume of the affiliations that we are calculating or projecting up until December the 31st in 2020, would be around $900,034 million, which that would be the impact we will have at an income level in all of our funds. So what are the funds that are mainly impacted? We have the fund for pensions and the health fund. Those are the ones that are mainly affected. And this relationship, we believe, is not only in our country, but also in the different countries in Latin America and around the world. But by the same token, as I said, on the other hand, we have an increase of pension holders. These pension holders that we calculate by the end of the year will be around 31,272 people. And this increase of pension holders will generate a greater need of resources in order to pay their pensions on a monthly basis, which will be around $260 million. A piece of information which is pretty important to consider is the fact that in Ecuador, a person, in order to retire, needs to have 30 years of service and have an age of 60 years. Up to 2018, people, the average of retirement age that we used to have here was 64 years old. Despite the fact that they could retire at 60, people in average would retire after 64 years old. Nevertheless, given the last figures, we've seen that this average has gone down, and nowadays is around 61 years old, so that the needs of coverage on the part of the pension fund, as time goes by, is increasing. Another element which is also important is the fact that the last actuarial study that we carried out last year, which was by the end of 31st of December 2018, indicates the problems we will be facing in the future, given the fact of the relationship between in 2018 of affiliates, active affiliates in comparison to pension holders was 8-1. As for 2020, and given the fact of the factors that I have just mentioned to you, this loss of jobs, etc., has diminished to 5.8, and by the end of 2053, the relation will be 2-1, which to us as a country, it is pretty important to have measures in the structural way, so that we will have sustainability of all funds in the short, mid-term, and long term. About the health issues, it is important then that you can see that it is true that Social Security has a number of active people. I brought this table from 2019. By 2019 we had affiliates, that is to say people that would be active, 303,010. The beneficiary population in the case of health, it reaches 7,280,000. So actually we're covering regarding health 40% of the population in the Ecuador. So this is a very important element to be taken into consideration, because while people that contribute every month, it's 3,310,000. In the case of healthcare, is given to 7,280,000 people, beneficiaries. So in here, in the case of something that has been marked during these last weeks, is the fact that the attention that is given to children younger than 18, that reaches a level of population of 2,200,000, because it's a population that yearly makes us spend $300 million, and it is not being financed as a defined, population for this kind of coverage. So, by the same token, we want to indicate which are the attentions and the invoicing that we have only in our inner network, which is 101 medical units. By 2019, we gave 6.9 million medical attention services in external consultation, emergencies, and hospitalization in the three fields. And this has had a cost for our institution around $1,500 million in 2019. Only in what has to do with the internal network of the IES. Nevertheless, as I said, we also have some external suppliers, and the attentions that have been granted in the case of external suppliers reaches around 5 million services, and approximately $5 million $500 million of invoicing, which means that globally we would be rendering in a year around 21 million of attention, medical attention, and then we would have an expenditure of $2,000 million per year, given the fact of all these medical attentions that we have rendered to the population. Some relevant data or pieces of information about the health situation and how this fact has impacted greater stress or pressure about the demand of resources on the part of the fund of pensions. Only in the period of time between March and June, which is the date in our country we declared the emergency due to the COVID pandemic. Externally, we had 219,235 consultations related specifically to the pandemic. And in the case of emergency attention, we have given 378,313 emergency cases. In the case of hospitalization, 11,200. It is important also to say that in here, the model of attention, there's this public network, let's call it, this public network of health, which is formed by the EIS and the Public Ministry of Health, the Institute of Social Security of the Armed Forces, and the Institute of Social Security of the Police Service. In the case of IES, we have had cities where the pandemic has been assisted. Almost the 70% of cases reported in the pandemic have been assisted by the medical units of Social Security, which makes this impact regarding the increase of the needs of medication and equipment by now has reached around $200 million, additional $200 million. These $200 million are needs of financing that have been required due to the pandemic that has been generated. And as I also said, as I mentioned before, it was a month ago passed a law which was called the Cavite Law, where we enhance the coverage for people that have lost their jobs. In the case of health, we widen the coverage to those people under dependents that lost their jobs for 60 additional days. That is to say that if a person that lost his job in the month of March, then we'll have to cover 60 days, 60 additional days. Now, the current day would consider 60 days. With this COVID law, we have 60 additional days. That is to say that the coverage time would be then for 120 days. And this obviously has generated a greater stress as for the disposition or liquidity of the fund. Something important here is that given this moment and the circumstances that we're going through, we do not necessarily the problems that are affecting in the short term the social security system have to do with problems of liquidity or money. But the need of resources and the use of resources is greater than the speed of the income or generation of new resources. So some recommendations and reflections that I consider important, and given the situation of the pandemic, it is that practically we have to analyze, to make a post and pre-pandemic analysis. Everything that we have had, all the projections and research that we had before the beginning of the pandemic, by now have to be rethought. So we have to generate a greater amount of studies. And so this is why it's so important. And we believe that we have to strengthen the actuarial areas in the different institutions of Social Security. And as we have said in some meetings we have had, maybe the topic of having strong actuarial areas, which is one of the weaknesses of the systems, we believe in this moment it is a priority that we start strengthening the actuarial areas, and through this strengthening then we'll be able to start having some research. And many of the studies that we used to have, like for example the actuarial studies, and by this moment, given the conditions that we have suffered from and the impact that the pandemic has had on the economy, it is important to see that in the years to come we will have to rethink necessarily all these studies or research. Another important element, and I believe with things like institutions like the CISS are paramount, is the fact of training our workers about topics regarding Social Security, because nowadays we see a weakness in the workers regarding knowledge of the topics linked to Social Security, but not only internally, but also by generating this training for the different actors, external actors that are linked to Social Security. This moment, given the fact of the pandemic and the change of all the macroeconomical spectrum that we're having, it is necessary that at our national levels we have to discuss about social security. We have to see forward or look forward and identify effectively whether the models that we have for social security are really sustainable in time. The pandemic has make evident the social security issues, and in some funds indeed generate a stress so high that leads us to rethink that indeed that's the security social model that our countries.
That our country should have, and if these are sustainable in time. I mean, to generate and to kick off this discussion, which is necessarily inclusive, I mean, it cannot be just that the decisions that are made only from one of the sectors. I mean, it's our calling to debate about social security issues in different sectors. It's extremely important to know who's going to sit down and debate about these things, because they have to be properly trained, because social security topics are correlated to society. It's social, it has political impact, and the theme does. We have to have the fundamentals, technically speaking. And we have identified that many stakeholders, I mean, we could call it, how could I say it? Many stakeholders correlated to Social Security, stakeholders who are generating opinions or of our citizenship have their deficiencies regarding the technical aspects of the components that constitute Social Security. Another important element is for us to broaden the opportunities to debate and discuss in activities such as this one, to share the experiences of different countries. The Social Security models depend on internal provisions, the vision, even it depends on culture of our countries. It is very important for us to be capable of sharing and identifying experiences and obtain the positives and find the positives that other institutions have that we can adapt to our countries. As I've told you before, it is necessary. It's totally there's no president at moments like these. So we must sit down and discuss the structural adjustments of the models that sustain Social Security because of the impacts. The impacts have to be measured in the short, mid, and long term. It is necessary for us to sit down and really discuss if the models of Social Security that we have is sustainable throughout time. And lastly, just to for closure, I have this in mind, and we've lived through this. What's factual is that we can profit from the opportunities that we have with events such as this one. We can work with social security entities like the Inter-American Conference or CEAS. We can sit down and negotiate at a regional scale what's happening with a medication or drug industry. Due to the pandemic, we've seen a price incremental of the drugs and medications and PPE or protective equipment, and the costs of all the aforementioned have an impact and an effect. They're high, and because and we have needs of these, but I mean, what about the resources for it? That's why we have to sit down and negotiate at a regional scale. We need to have the access during these negotiations to the medications, drugs at lower price or cost. Thank you so much for listening. And I'm here waiting for all your questions or any restlessness that you might have. Thank you very much, David, for participating. It is important. The information you just shared and your insights are very important. I agree with you. We need to strengthen the area of actuary in all the areas and all the agencies that work on Social Security. Right now, we're going to coordinate the participation of Sonia Lopez Logman. She's going to be talking about the Guatemala experience and COVID's impact on on the institutions that have been affected. She's a computer science expert and master's on Social Security studies with a proper activity in labor as control of pensions head and aging and survival under secretary and the technical secretary of the commission. And she's been appointed for many other positions. We remind you, those who are listening to us, please ask your questions through our chat so you can receive a response through this webinar. Sonia, you're welcome. Welcome to our center. Thank you for your participation. The floor is yours. Well, thank you very much. For me, it's an honor and a pleasure to participate in this webinar. I will share now the presentation that I brought for you today at the moment. I hope and I expect that this is not our only webinar. We have so many topics to discuss. Sonia, could you, okay, there's your presentation. Thank you. It's there. Could you just share the full screen, complete screen? Ready. Well, thank you. As I was telling you, I expect this webinar not to be the last one. There's so many topics to discuss. As part of the Commission on Actuary and Financing, we'd like to provide technical support to all the members to find solutions and alternatives to the problems of sustainability and sufficiency that Social Security is facing. As it's been said by Gabriela, I work in the Guatemalan Institute on Social Security. It's in charge of administrating the regime or the schemes in Social Security at Guatemala. We have two main programs or schemes. That's one for maternity, accidents, incidents, and others that provide the full attention in the healthcare system. There's economic benefits. There's another program of aging, survival in different discapacities in the pension scheme. Now we have the contribution regime that's well defined and it defines its benefit. It has its premium that's it has certain levels or tiers and methods. There's collective capital. As you well know, many Latin American countries have a pension scheme in general due to contributions on Social Security. The types which are defined are the following: Argentina, Brazil, Cuba, and Ecuador, Honduras, Nicaragua, or Paraguay. It's a mandatory regime in which all the labor force participates because there's this dependency on it. It's tripartite. It's coordinated by the 3.6 support or contribution by the employer, and the workforce provides 1.83% of their salary, and the state also has its participation, which is 25% of the expenditure, and that should be contributed to the scheme. The state only partially contributes. But additional to this, we have the yields of the technical reserve, because it's a system that's collectively created with that capital. As I've told you, all the workforce have that affiliation, or they depend. We have different workers of the state that have their own retirement scheme or plan, and we have a different type of class which has their own ways to retire. The amount of benefits is determined by an applied percentage depending on the accrued income and years worked by the worker, and where there's an assessment as well. The premium and the tiers in this method, there's the fees and the interest of the reserves that lead us to analyze all the income, which should be sufficient for paying the commitments. It's a program that's relatively new. It kicked off in back in 1977. And the employer and the workers contributed with a 4.5%. And back in 2000, there was a need to create this steps to update the premium, and in 2016 it was 5.5%. What's the current situation? of this type of scheme or plan. The workforce in Guatemala has its traits or characteristics. There's unregulated subjects. According to the National Survey of Income and Employment that dates back to 2019, 70.2% of the active economic population is not regulated. There's unregulated subjects. We're talking about 6.2 million people who are subjects in that sector, and that it's not regulated. And in the population in Guatemala surpasses a bit the 16 million workers. 6 out of 7 workers, or 7 out of 10 workers, are not regulated. 29.8% only of our population are regulated subject. Now, on the contributions on Social Security, there are only 1.3 million workers. So it's 1.3 million workers receive the insurance or receive the benefits along with their beneficiaries, and they give us a total of 3 million of beneficiaries by the scheme or regime. Now, this is the pyramid of the members that are part of the scheme that date back to 2019. They contribute all, and as their members, they contribute to the IVS program. And in that program, our IVS program, only 1,776,491 people are under that protection or coverage. There's other percentages of coverage, and that's the correlation or the matrix of data with those who are members that are part of the pension scheme or IVS pension scheme. So it's 8 out of a few. So this means that our population is still very young. In 1985, our population was very young. We had a high quantification of kids, and there were also healthcare needs for the youth and primary attention services. In 2018, we had an incremental in our population, in our youth, in the segment of our youth. This leads us to have more employment opportunities in higher studies and education. By 2050, our population will have aged, that's the forecast, with incremental needs on Social Security, health, and other healthcare services and needs. The current situation is something that worries us. Since there's not many in our population who are under the coverage or insurance of the pension scheme, we only provide coverage to 14% of the senior population. 11% they are liability or for the state, and the other 14%, there's a contribution or an economic assistance or bonus to those who are marginalized in conditions of extreme poverty. It's a social assistance program. 64% of the senior population do not have economic protection for their retirement. Now, that's the current situation, and the forecast, as I've shown you in the previous chart, depicts the population of our aging population in 2015, which leads us to take immediate action. However, the state is historically in debt due to in the concept of the employer. That's the historical debt. There's some government officials or workers and that contribute, and as a stakeholder of the tripartite scheme on Social Security, we can see that over 48,000 or $48 million is what the Social Security has as debt. It's $6 billion. Which are the effects of COVID-19 on Social Security of Guatemala? Well, on one hand, the Guatemala Social Security Institute, IGSS, implemented measures to recover economically due to what's generated due to the sanitary crisis in its area of exercise. Since March, the directive board approved the deferment of payments of the employer's payments or contributions in March and May. There's that deferred payment to this year. During this time frame, the employers will not receive any interest or other capex or capital expenditures. This creates an incentive to preserve the workforce at place. More than 4,000 workers or companies have decided to defer their payment or contribution. However, there is a decline in the number of members who are part of the Social Security scheme. In April 2020, the members registered was 1,265,302, which is inferior in comparison with the same record that we have that dates back to 2019, which was 1,367,313 members. In this other matrix, I share you the contrast of the data that we obtained in April and their variance in the past 5 years. Why April? According to the program of Department of Actuaries and Statistics of the Institute, this is an effect of the emergency situation derived of the pandemic and the behavior of this in the past few years. April is the month in which we have the report or record of the most members that are affiliated here. We have 102,011. This represents an estimated number of 32 million in income reductions to the programs EMA and IVS. Now, also, the Monetary Board of the Bank of Guatemala, Guatemala Central Bank, had that 0.75 cents of decline, and this is also a cut in income in the portfolio of investments in the IVS program. How is the stability of our pension system currently? Well, I want to talk to you about our program. Here we have the expenditure due to the pensions, in our pensions, because of the risk in aging. That's the 76% of that graph, 19% to the widows and orphans with a risk of survival, and a 5% in the graph are the expenditure in the risk of being invalid at some point. The benefited people, according to the risk, have a higher percentage in survival with a 51%, a 44% due to aging, and 5% in the type of invalidity. Now, the actuarial assessment or appraisal that dates back to 2019 leads me to show that there's economic capacity to finance depending on the system. If we think about the financing premium as 0.5%, which will not be in effect by 2025. So the current one is 5.5%, but currently in their services in 2019, the program has enough budget capacity. And this is something that you could see in our chart here, where you can see the superavit. And in the last column of the chart, you see the forecast for 2020. In 2019, the superavit is the difference between the income and expenditure reached 35.44%, which is superior to what we analyzed in 2018. The indicators here permit us to see the capacity of budgeting the program with the superavit and the financing premium and adopt the proper measures. During the first semester of year 2020, it had a contraction 32.72%. However, that's a very important margin. It's a leeway, but we have to be carefully watching over this. Now, the growth rates of the amount of the incomes during the last 3 years have been 7.2, 4.7, 3.3. Accordingly, as you can see in that chart, what leads us to have proof of evidence of the lack of acceleration in the income. In the next period, you see the growth rates of 7.1, 8.7, 9.7 accordingly. And this mirrors or leads us to see a sustained growth of the costs. This means, or I mean to say, that there is a decline. The income, there's a decline in income, but not in others, which in other areas which are incremental. Right now, we don't have reliable information of the effects that the pandemic could cause on the lack of growth in the economy and the variables of membership, the interest rates of investment reserves, the death rate of those who are under the pension scheme. In the current study of actuaries, we considered the deferment of the employer's fees, which shows a decrease in the income during this year. However, the inclusion or the effect in the IVS program, we estimate the measures. We maintain the effect of the premium till 2024. Which are the perspectives and scenarios here? Well, the scenarios are what we see as a deterioration of the workforce, work market. There's no sub-regulated subjects there, sub-employment opportunity. They don't qualify. They cannot be part of the social security scheme, or maybe they don't do it timely to be capable of being part of the pension schemes for retirement. The lack or the low coverage, which is only 18% of the population who is actively active that are part of the benefits can have their pensions in the long-term risk. There might not be that solidarity between generations. So how can we finance Social Security? Well, maybe with more fees, more taxes on Social Security, the changes in our demography. We have to observe what's happening and profit from the opportunity that we have because of the traits of our population and face the time being and what's happening also with the life expectancy. If they're an incremental on the life of our people, then they're gonna obtain the benefit of a pension for a longer time, and that's not sustainable financially speaking. But on the other hand, our people are living longer with chronic diseases, which leads us to have an exponential growth in the healthcare expenditure. Currently, the decision-making process is based on results, short-term results. There's high demand. Also, there's a lot of demand from different stakeholders, so they want them to be part of this immediately, the benefits immediately, and that doesn't enable us to work also on the side of public policy drafting. So public policy is a public policy is a cross crop that should lead us to social protection. In Guatemala, there's an isolation in the ways in which we could protect the vulnerable groups, and what we should do is to integrate them in the decision-making process to achieve long-term results. We need to achieve the principle of Social Security being universal. We can achieve this with a broader coverage. We can start by protecting other entities which are collective, all the sectors that are the subjects who are not regulated subjects. We can protect them and make sure that they can have their pension for their old age, or in case they lose their lives or are invalid, it's disabled at some point. Now, the scenarios, we know that the regime of Social Security in Guatemala has its benefit schemes which are sometimes minimum. We need to assess the pension scheme like a secondary or a parallel pension scheme that's already part of the internal law of Social Security agencies, which gives us the basic data. However, we have not promoted this so we have a dignified retirement when we've aged. We don't have an unemployment insurance in Guatemala. We have gone through these studies. We're about to pass it to the directive board. We're going to discuss the unemployment insurance. It would have been great to have the unemployment insurance amidst the pandemic. However, we have to see this and what's going to happen with this in the long term. The people can have an unemployment insurance, have it easier if they just work in the as unregulated subjects. If they don't have a job, they have to generate an income to sustain their families and themselves. If they don't have a job, then they go to the unregulated part of the population, and having that insurance, they could have rights to their health benefits and Social Security benefits until that person has a normal or a job position. We have to think about prevention as part of the economy. If we're aging and have conditions, as the previously mentioned conditions of the other keynote speakers, I mean, we're going to live longer, but not in the proper or best conditions during the aging phase of life. And having a preventive economy will lead us to reduce or cut back in our expenditures when trying to pay the proper services to satisfy the needs when somebody suffers a chronic disease. We have to plan out what we have with our installed capacity. Pardon. We have to be capable of doing everything that we're planning, but we still have to plan based on external situations such as the one we're going through now. I mean, anything else could happen. I mean, a natural disaster could happen, or a situation as the one we're now living through. We need to properly plan to face all of these situations. And I will finish with this insight. A pension scheme is intimately correlated with the transformations of the labor market, the life expectancy, demographic changes, and other variables that put at risk sustainability. if we don't consider the scope of the problems that we're facing, and if we don't learn from the past, if we don't learn from other countries in the region, and if we don't go through the necessary adjustments and changes, we will not comply with the objectives of having our people live a healthy retirement age with a dignified life. Thank you very much. I leave you with my email, and I'm available for you for any question you might have. Hello. Thank you so much, Sonia. It's very interesting to have you participate. The measures that the Guatemalan government has adopted to try to have incentives for employment. In your decision-making process, you have highlighted the importance of giving proper coverage to the principles on Social Security and working hand in hand. You're working. So we must highlight that the situation that you have led you to forecast your future, and that's why you have that unemployment insurance project or initiative, which is very positive according to me. Now we're going to continue listening to Ms. Pilar Rivera Popovic. She is based in Mexico. She will discuss challenges in Social Security of the workers for the state. Ms. Pilar Rivera right now is studying her master's in finances. She has a degree as an actuary on thanks to the Autonomous Institute of Mexico. She has over 7 years of experience working as a public official in the Social Security Institute and social services for the state workers. She is now appointed as the subdirector of the area that surveils and gives monitoring to the services. Ms. Pilar is the president of the commission in this field. Thank you, Pilar. Welcome to the center. The floor is yours. Thank you very much, Gabi. You can see my presentation up in the screen. Is that correct? Yes. Perfect. Now, I will be talking to you about the challenges that we're facing on Social Security and the workers for the state. Now, in Mexico, particularly what we see is that Social Security is under a fragmentation. I belong to this institute, which offers benefits, insurances, and services and financing of the aforementioned, all established under our laws and regulations. We have the legislation that protects us in the Code of ISTE, or the internal law of ISTE, which is the entity for the workers of the state. As part of the benefits that we have a list of 21 services. The health service or the health insurance is of top relevance due to the coverage that we have in all our country. In the pensions, we have pensions when somebody is disabled, and risks at work also is insured. In also areas of aging or retirement, we are in charge of obtaining or centralizing the quotas, fees, or payments, contributions to the administrator for the retirement fund. And the retirement fund is in charge of administrating these services. Social Security and cultural services is one of the relevant benefits of the Institute for the population of members who receive a pension, and the number of kids that we also have as part of our pensions and the daycare system that we have. We also have an integrated credit system that's constituted by the areas of personal loans, mortgage loans, and other types of services in which we allocate or grant personal loans to the workers of the state, mortgage loans or credits to the workers of the state as well. These two types of benefits are also given or allocated to workers of the state. Pensioniste is some sort of administrator of pension funds that's led by the government as the institute is part of government. The population we pay services to is 13.5 million benefited members. In Mexico is 11% of the total population of the country, and as well as the other countries that you have shared your presentations with us. We have our economic situation is very important. The rest of the population receives services through the Ministry of Health and the Mexican Institute on Social Security, which is IMSS, that has covered 40% of the population, and other workers that are also formally contributing and are part of the formal workforce. In our population, we have 3 million workers who are distributed in the following way: 56% are women, 44% are male. And this data is extremely important because we're an institution that is constituted by more women, specifically because of the sectors that we pay our services to. 48% of our population of workers are from the education sector, and 44% belong to the public administrators, to all the bureaucrats of government, and 12% is all the health sector, and 6% of this population who is working is there. So we can also cover universities, public and other state universities, different workers from the states that work, and in different state entities. The number of members that we have is 1.2 million people who receive a pension, and the age average is 66 in women.
And men have an age of around, sorry, I gotta see my presentation again, 68 years old. Then we assist 9.3 million family members of these beneficiaries, that they can be spouses, children, and even sending family members. So workers can, for example, give an insurance to their parents. So here we have the population pyramid, where we can see the vast majority are workers between 35 and 54 years of age. And we also have an important proportion of workers that are older than 60 years. The distribution of pension holders is located between a population older than 75 years old, which represents 43% of the population. And from 60 up, we have the vast majority. The pension holders, which are younger, 45 years old, has pretty little, not very many people. And these are people that have inherited a pension. Another factor that is pretty important to measure, besides the characteristic of demography of our population that I have just shown, we have many elderly people, it's epidemiology. So in here, I show you a graph of the distribution of the demand of consultations by group of age 20 years ago compared to this year. So we can see that 20 years ago, the population older than 45 years old that would demand a consultation would represent only 40%, more or less, while now it represents 70%. So we are having a high demand of population in this age range, and some percentage of these consultations have been due to chronic degenerative illnesses like hypertension, and diabetes. So we also have a prevalence of diabetes and hypertension, blood pressure is pretty important. And what I show you here is that these two diseases are focused mainly in population that are older than 50 years. To me, it is pretty important to show you this, because what we've seen in all the information that we have about the implications of COVID-19, the mortality is given mainly in people that have some sort of prevalence of these diseases that are chronic and degenerative. And what we show here particularly is has an important population of workers and pension holders in these age ranges, and besides with this prevalence of chronic degenerative diseases, not to mention cancer and tumors that also represents one of our main causes of death in the beneficiary population. And breast cancer is one of the first chronic degenerative disease, because we have a greater population of women affiliated to the institute than men. We have 25 general hospitals and 14 regional hospitals around the country. Here you can see a map of Mexico where you can see where our hospitals are distributed, particularly the states where we have a regional hospital. We do not have general hospitals, so we have regional hospitals. They have a high demand of services of second attention level or second tier of attention. We have a high specialty medical center that is focused on cancer in children mainly. And all these cases go to this medical national center, which is located in Mexico City. The response that we have had before COVID as a player within the public health system in Mexico, it has been a very important collaborations between institutions. We have a law which was presented at the beginning that tells the services that we have to render and the way we're going to finance them. We also have the Ministry of Health that says all that has to do with health that we have to obey before the implementation of health insurance in our hospitals and medical units. So one of the main actions that we have implemented in Mexico were the consolidated purchases, which meant that we united the complete demand of the health sector, and all the purchases were made through the Ministry of Finance, which has allowed us to have more competitive prices in the international markets as well as in the national market of medical merchandise. We also had units of attention for COVID patients, collaborating with the National Navy and Army. So this was a collaborative action where we in the East had some infrastructure that wouldn't have been enabled to operate. So we had it in the disposition of INSABI or the Navy or the National Army, so that they would give all the medical personnel or staff or all the necessary material, and then we would be able to operate with this. The attention to COVID patients was a strategy that was created by state, where you do not necessarily, the affiliates to ISTE were able to go to ISTE hospitals, but we defined the hospital specifically for the COVID attention, and some other hospitals for other kind of attention. So in this sense, the attention has been a very well organized work between the whole health sector in Mexico. And talking about the post-pandemic challenges, it is true that today we've been caught by surprise this pandemic, where had to adapt many things in the hospitals and the requirements and the kind of specialists that we need for the attention. We also have a great challenge in respiratory diseases. So here I show you some statistics from the OECD, where in Mexico it has the 5th place in deaths by respiratory diseases. So COVID in the end is a respiratory disease that impacts the respiratory tract. So we have a big challenge there as a country to take care of and have intensive care units prepared in order to face this respiratory disease disorder. At ISTE, the respiratory diseases are the 4th cause of mortality, which what we have seen with COVID now is that this statistic is going to importantly grow, and it can become the 2nd or 3rd cause of death after all, the deaths that we have had in Mexico. Yesterday, the figure was around 41,000 deaths by COVID. And here I have some statistics of all those respiratory diseases that we have, where we had June accumulating COVID, pneumonia, and suspicious cases are the main causes of death. And just like in the rest of the world, we also see a greater incidence in the mortality in men. what we have seen is that 61% of men are the ones that have died due to COVID, while in total, women represent 39%. And as you can see in this graph, besides where the greater mortality is concentrated is in elderly people older than 65 years old. So that implies to us a greater challenge due to the kind of population that we have and the degree and the high number of pension holders or beneficiaries that are older than this age. So that implies that we will have to think of the measurements in order to take care of all these pension holders and the attentions we will have to give them, the demand of health services. Another challenge that we face, and I believe is pretty important that we have analyzed, is that out of the workers that are affiliated to Institute, 12% out of those are older than 65 years old, that which implies that they have the requirements to be retired and get a pension. And as I told you, the vast majority of our population of affiliated workers are teachers, public administrators, but we also have an important number of people of health ministry workers and workers of health. So this will imply that the risks that we already have now due to the kind of workers that now we give attention to, then today, given the situation of COVID and we still are not able to control and due to the measurements we have to take, that all this population of workers will have the decision or make the decision to retire and get a pension. And then we'll have then two impacts. First of all, having the necessary staff due to the, hirings that we will have to do due to the population that will leave, and second, expenditure that will imply for the payment of all these pensions. And, against, the fact that all this thing is going to go down until we have all these workers that have gone actively working with other workers. Another question that we have analyzed also as health sector, and it's one of the public policies boosted by this new government or administration, is preventive medicine, which is pretty important to us, we believe, because we have seen that the most affected people by COVID-19 are these elderly people with these chronic degenerative illnesses. Also, they've been young people that have obesity problems. Every year, we have a greater incidence of people with chronic degenerative diseases. Actually, the results of the National Nutrition questionnaire held in this year said that the children between 5 and 19 years old, 36% of these are obese and have overweight, which is a risk factor which is pretty high, as well as adult people 20 years old or more. The proportion of overweight and obesity is 75%, which is a very serious problem of obesity. And we know that these conditions are the one that cause chronic degenerative diseases. So one of the main activities or actions that we will have to implement is preventive medicine. We are working hard in this and campaigns and very specific programs in order to generate a healthy and balanced food intake, physical activity, and medical checkups regularly. We have to have all the tools, and that would imply curative medicine to give attention to all these illnesses that we already have. We need to focus on promoting the preventive medicine. And a little bit talking about what we've been facing is that today, with all these beneficiaries that we cannot have here attending in our offices, and we have a great challenge in the digitalization of paperwork. There's a little bit of the regulation that limits us, the kind of things that we can do digitally, but it is something that we have to boost importantly, because a great example of this was that for the first time in 60 years, the Institute will become this year 60 years old. And we had the raffle of the personal loans in a where something where everyone would participate through a web page. So all these kind of actions that the pandemic has forced us to have definitely are the kind of things that as an institution of social security we will have to continue boosting to make paperwork a little bit faster, so that the exposition of all these elderly people and beneficiary population would avoid the risk situation due to commuting, so on and so forth. The payment of pensions are through bank transference, and a post-pandemic challenge that we now have, due to the kind of population that we give attention to, are the benefits that we have to evolve according to the demand to our beneficiaries. We have a benefit which is called Casas de Dia, where beneficiaries have access to these homes where they can have different activities, where they can mingle with the other beneficiaries and do some activities like physical activities, some workshops, cultural workshops, so on and so forth. And so this has been a demand from the beneficiaries, which in our law should be established, because by the end of the day, our population is getting old. So it is, they're having certain demands that we will have to address. And lastly, and we have the great challenge of financing and funding. Logically, the expenditure that we've had to give due to the pandemic situation and the COVID disease, particularly to establish intensive care rooms that evidently are a high expenditure, the intensive care services, and that will imply a greater expenditure. In the last actuary and financing study that we had in the month of July, we saw that actually the 4 funds that we have, only one is enough. That is to say that the contribution that we by law charge are only sufficient for the patient's pensions for work risks. The health insurance is not enough, and it has been insufficient for more than 15 years. We've been having this problem for more than 15 years. And the insurance of disability has been enough up until 2 years ago, and then we can see now that it's in a point of balance, but the expenses are being greater than the income that we have, and the social and cultural services have become a need for all these beneficiary population, which also have a very active activities with the institute, where they demand a lot of attention and activities, so the contributions are not enough. Particularly these cultural and social activities would demand a double part of what we're now charging. So the financing issue continues to be a challenge, not only in ISTE, but all the systems that we have for Social Security in the States. We have a great problem of pensions. Yesterday, actually, the president, together with the Ministry of Finance, talked about a reformation in the pension law, where the option is to increase the contributions that employers have now for these security system, private security system, social security system. We have a very serious funding problem, which is subsidizing the federal government, is supported by the federal government. So that would be everything on my presentation. Thank you very much. So we thank Pilar for her presentation. It's pretty clear all the challenges that we have for Social Security with the workers in Mexico. Still, the experience, which is pretty important, it's going to be documented so that we will compare it, because it's going to be very useful for the rest of the countries. I want to tell you that we have a great audience in this webinar, and we know that, sorry, I'm not hearing anything. All of a sudden, okay, it's pretty, we have a very short video about an invitation that we have for a diploma course on senior management of Institution of Social Security, which will start by the end of August. So we want you to give you all this information, and then later on we'll have the Q&A session in charge of Gabriela. So a little second, please. So we'll start with the video, and we'll tell you that diploma course has 5 virtual models and a presential model. This will be held in January 2021. This model has been made or elaborated as seminar due to the fact that since it's an on-site activity, we can have a simultaneous interpretation to Portuguese and English, which are the languages that we have in the conference. So by doing this, the diploma course will have an autonomy regarding the topics, and we will be able to certify it independently so that there will be participation from the countries that are in. While we have the video, we're going to start the Q&A session, and then after this, we'll be showing you the video, the promotional video. Thank you. Okay. Well, then we have had an important participation on the part of the audience. And just to start with, they're sending you, all the speakers, greetings. Greetings to the Social Security of Guatemala, Ricardo Segura, and lawyer Israel Pacheco Barajona, board manager of the Board of Pensions and Retirements of Costa Rica. They tell us that in Costa Rica, this issue has impacted the working force at an informal level. Then the laws are impacting a population has had problems. Some organizations have helped low-income people. So greetings from Mexico City, where IMSS Bienestar program we work, and then they thank you the opportunity to know the experiences and success of other countries. Thank you all to all speakers. So we'll start with the questions. So whoever can answer the questions will please activate your camera. Well, you all can activate your cameras now and your sound too. Now the first question, the one, which opportunities have been identified so that will redefine and strengthen Social Security? Have you defined strategies to rethink the model of health in the framework of Social Security? Who will give an answer? Well, if you allow me. We see it as an opportunity to be able to widen the coverage of new sectors of the population. The Social Security in Guatemala is a model where we protect workers, formal workers, but we also know that this situation of the pandemic is going to lead us to other forms. We are identifying many people that are working independently, many people that are doing telework, and this will make many companies to think and be able to solve in certain way the structure of their businesses. So we cannot stay behind, and we cannot only protect these workers, we have to protect all the population, and the universalization is not that easy. We have a commitment, public policies that will be integral to protect everyone, but we can start with new sectors by opening mainly the provisional point, saving from and another kind of apportation later on, or contribution later. We cannot hear you, Gabriela. Can you hear me now? Yes. Oh, okay. Yeah. Thank you. Well then, thank you very much for your participation. And then the next question is for the Panama speaker. How many beds per inhabitant do you have, and the number of serious cases, to give a dimension of the structure of social security? That is to say, how much has the coverage, which epidemiology measures have been implemented, and what their impact has been? Mariano Torres from Chihuahua, Mexico. Well, I said that the complete country, had 9,004 beds available, but the intensive care beds, we only had, before the pandemic, 3,338. Definitely, which is according to the amount of cases, which is 55,000 or so, which have been positive, we have surpassed the availability in the hospitals. Given nevertheless, we had some measurements, such as the lodging of some people with positive cases in hotels. We have had some hotels, and they have been locked down there with these positive cases in the hotel, so that there will be no collapse in hospitals. But in any given case, most of the positive people were also locked down in their homes, because definitely we surpassed the installed capability of the hospitals. Also, they ask, which sector suggested the revision of salaries of public servants, and what are the mechanisms that have been suggested to reduce these salaries in terms of hierarchies and public positions? The law project that has been presented was presented by the president of the reopening of session of the assembly on the 1st of July. We suggested that the positions of vice president, minister, and president, managers of entities, or directors of sub-directors, and managers of sub-managers, would be having a reduction in their salaries. And the first positions, president and vice president, 50%, and the rest would be at 25%. Nevertheless, this is under discussion in the National Assembly, and they can either be incorporated, some of these positions, or they can be sent away. It's not something that has been passed yet, but it has been proposed. Thank you very much. Thank you. One more question that is for Professor Roales. They ask about if you can talk a little bit more about the retirement age, because there might be some confusion. about the age of retirement in Ecuador. Okay. In the case of Ecuador, the law says that a person has to be 60 years of age and must have worked for 30 years and giving contributions. What I was telling you, that despite that's what the regulation is establishing, 60 years of age, people before 2018 would retire later. As an average, they would retire at 64 years of age. But now this average has gone down to 61 years of age. Thank you very much. Then the next question, Novel Vigeda, it's not for Panama particularly, but whoever want to answer. What are the special measurements for medical personnel as for infection? Because it's not considered as a work risk, but it's a general disease, considered as a general disease. If anyone would like to answer? Well, if you allow me, in the case of Ecuador, we have identified protocols in the sense that not all of our medical units are medical units for the attention of COVID. And depending on the medical personnel, depending on their area they are located, we have a protocol defined of the materials or the protection equipment that each and every one of these people must have, that is linked towards COVID, either COVID or not COVID hospitals. And in those cases where it is a COVID hospital, it would all depend on the area these people are working in. Thank you very much. With this question, and we finish what we have the virtual part of questions, but still we have the chat open to receive your comments, and we'll give you answers through this same means. We're going to have the video now about the diploma on senior management on social security institutions. Oh. Some information that requires some institutions of social security in the countries in the Americas that will allow them to prepare them in the systems of social security. Then we'll talk about and considering that we have to be prepared to face the challenges that we will have in the Americas and the institutions of health and institutions of social services, representatives of workers for the sustainability of social security. Sorry, there's an echo in the video, and then unfortunately it is a little bit difficult to interpret this. Sorry. Senior direction and institutions of social security, or senior management. So these seminars with 11 magistral conferences and 5 workshops. Teachers which have been highly qualified, and the participants will acquire knowledge in topics such as management. No, sorry, I cannot hear clearly. Oh. So if you would like to have more information about this, please contact us through Facebook or the web page CISS, Seguridad Social. Well, thank you very much for your attention. So in this way, we are going to finish our Q&A session. We would like to take advantage of the opportunity to greet all the participants from Granada, which today were with the Anglo-Caribbean, and to us, as well as for all the participants, are pretty important, but they represent one of the sub-regions where we are working in order to strengthen the offering of services. So I will now go through to the final reflection about this important activity. Definitely, we have had a morning with experts where a series of reflections that are available. We're going to share with you the presentations later on, as well as the seminar. Our webinar will be inserted in the YouTube channel, the conference. And there's a commitment from the research area of the CISS by forming, with the experiences that we have presented here, a document in such a way that the materials that were prepared by the speakers today are going to be consultation and motivation material for the systems of Social Security in the Americas. On behalf of the CS, we talked about some topics which we're going to pay attention to in our programming. We were talking about today about the strengthening of epidemiology research in the countries. In Panama's talk, we had the recommendation, and we believe it is pretty good to say, and the great importance from our point of view, where we can have some direct action. And the other one is the strengthening of the actuarial areas in everything that has to do with social benefits and pensions, which is also within the priorities of the conference, and is being worked by a team of actuaries in here that Gabriela is part of, and she has been with us this morning. We've also had from Ecuador a recommendation or suggestion that seems to be pretty important, which is establishing regional negotiations with the transnational industry of medicine. We're going to take the idea and try to see from the area of expansion of CISS how we can work in that sense. So by doing this, we say goodbye to you and thanking you for your participation and giving the commitment of continuing with the topic. Today we had some experiences from the 4 countries that have been with us, and they have been important. And we also know that in the rest of the countries that make part of the member countries, we also have more topics to talk about, more recommendations, and more reflections. So thank you very much for your participation.